Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the pharmacology of the Ipratropium bromide. The Ipratropium bromide is a quaternary derivative of the atropine. So this is a quaternary derivative of atropine. And we know that atropine is an anticholinergic drug. So ipratropium bromide is also an anticholinergic drug. Okay. So this drug, what are the indications of this drug? Why we use that indication? The therapeutic indication. These are in case of bronchial asthma, COPD, that means chronic obstructive pulmonary disease, obstructive pulmonary disease, pulmonary diseases that include bronchial asthma plus emphysema and also chronic bronchitis. Okay. Ipratropium bromide has another preparation for rhinorrhea and rhinitis. Okay. So these are the therapeutic use in case of asthma and chronic obstructive pulmonary diseases. So we got the therapeutic application. Now we'll go to the mode of action. Mode of action. This is an anticholinergic drug. It works on this is the respiratory passage, the trachea. We have the bronchus. Okay. And the lung here. We have lung. Okay. So this bronchus go to divide multiple divisions. Okay. It will go through multiple divisions, and these divisions, and we have primary, secondary, tertiary bronchus. Then we'll have the bronchiole. Okay, so in the bronchus and bronchiole we have the smooth muscle. So this is smooth muscle. We have smooth muscle here, smooth muscle. So this is an anticholinergic drug. We have receptor here, muscarinic receptor, muscarinic receptors. Okay, those are present in the bronchial wall. Those are present in the bronchial wall. Okay, these are the smooth muscle here. We have smooth muscle here. Okay, in case of bronchial asthma and chronic obstructive pulmonary disease, these smooth muscles are in spasm. So the action of this medication, this is antispasmodic. It is also decreases secretions from the glands. So we get smooth muscle. We have also glands here, glands, mucous gland, serous gland. Okay, also goblet cells there. So this medication, Ipratropium bromide, this will work on the smooth muscle and the gland. It will decrease the secretion of the gland, and it decreases the spasm of the smooth muscle. So it is a bronchodilator. Okay. So this is the mode of action. It is antispasmodic, anti-secretory, and this is a bronchodilator. Okay. And we know the nerve supply of the lung is from the vagus nerve, that is parasympathetic, and it releases acetylcholine, and this medication is anticholinergic, that is anti-acetylcholine. So if it suppresses acetylcholine, then there will be no spasm. So the lumen of the bronchus will be dilated by this drug, because no spasm in the muscle, lack of secretion. So this is the anticholinergic drug, so it will suppress the acetylcholine, that is the mode of action, and work on the muscarinic receptors. So this is the mode of action of the Ipratropium bromide. Okay. So it is used in case of bronchial asthma. For bronchial asthma, we have other drugs like that of beta agonist like that of albuterol, salbutamol. Oh, okay. So they work on different receptors on the smooth muscle. These are bronchodilator, these are agonists, but this drug is muscarinic inhibitor. It work on the muscarinic receptor. So it is anticholinergic, and that work against the acetylcholine. So mode of action is different. This work on the beta agonist, on the beta receptor, and that work as an anticholinergic on the muscarinic receptors. Okay, we got the mode of action. Okay, so onset, this is a slow acting drug. So onset of action, it takes about 15 minutes. Peak action, there is the pharmacokinetics. Peak action, it needs around 1.5 to 2 hours. Half-life of this drug is about 4 hours. Okay, so you got the pharmacokinetics of the Ipratropium bromide: onset of action, peak action, half-life. Okay, its action is little bit slower than that of the beta agonist, like that of the salbutamol. It needs at least 15 minutes time to come into action. Okay, we got that. So we got the mode of action, indication, and the difference between that of the salbutamol. Okay, it is used in case of chronic bronchial asthma. It is used along with that of the salbutamol, or in some persons who cannot tolerate salbutamol, they have some type of heart problem like atrial fibrillation. In that condition, this medication is the indication. So salbutamol may not be taken in that condition. But both the drug work together, and that they have synergistic action. they will cause better bronchodilation when both the drugs are used together. So, beta agonist plus anticholinergic, okay, so both work together, that is synergistic. So that will cause more bronchodilation than that of the individual medication. Okay, so salbutamol plus the ipratropium bromide work together as a synergistic mechanism. Okay, so we got that. Now, what are the adverse effects of this drug? Adverse effect of this drug. Actually, it is safe medication. Safe medication. Why it is safe medication? Because it is only taken by inhalation as an aerosol or as a nebulizer form. Okay, so it does not go to the circulation, it does not go to the brain, so it is more or less safe medication. But still, it is an anticholinergic drug. We may get some type of adverse effect on a rare occasion, like blurred vision. Blurred vision. This happened due to mydriasis or pupillary dilatation. Okay, blurred vision is possible. Maybe confusion. You may have retention of urine. So, person with prostate gland enlargement, they should take precaution. Retention of urine. It is an anticholinergic drug, so it may cause constipation. This all happen rarely. It is more or less safe drug because it does not go to the circulation, does not go to the brain, but still it is possible in rare occasion. Constipation. Okay. Distaste in the mouth. That is a possibility. Okay, cough, because it may irritate the respiratory passage. Cough. Okay, and it may cause bleeding from the nose, epistaxis, maybe due to mucosal dryness, bleeding from the nose. And massive dose of ipratropium, high dose of ipratropium, may cause paradoxical bronchospasm. That is rare, but it is possible. Okay, we got the adverse effects. Plus, we have headache, nausea, vomiting, drowsiness. Okay, that may happen. Drowsiness, nausea, vomiting, drowsiness, nausea, vomiting. Okay, so these are the adverse effects. But as a whole, it is a safe medication. Okay, so any type of allergic reaction? Yes, allergic reaction. Allergic reaction, it is contraindicated in atropine allergy because it is atropine type of drug. Okay, allergy. It is contraindicated. It is contraindicated. Indicated in case of atropine allergy plus peanut allergy, especially in children. Allergy. So this should be very much, people should be always alert about that. Atropine allergy and peanut allergy. These are contraindications. Okay. So during pregnancy, okay, there is a report of congenital birth defect, but like other medication during pregnancy, it should be taken with lot of cautions. Okay. Usually it is harmless. it doesn't go to the lactation, but may come on a very small amount in lactating mom. Lactation, it may come in very small amount. Okay, so we got the pharmacology of the Ipratropium bromide. This is a medication for bronchial asthma, chronic obstructive pulmonary disease, emphysema, okay, or chronic bronchitis. So, and that's all about the pharmacology of the Ipratropium bromide. If you have any question, please feel free to ask me. Please support my channel, subscribe me, and share the information with your friends. Have a nice day. Bye now.